related to vaccinations and masking. Now, as you have most likely heard and most likely seen, the CDC released updated guidelines for fully vaccinated people last week. Now, the new guidelines state that fully vaccinated people can return to their normal activities, such as without a mask, either indoors or outdoors. Now, these new guidelines are supported by ongoing evidence showing that vaccines offer strong protection against COVID-19, and it allows people who are vaccinated to begin to return to their normal activities without worrying about getting significantly sick or spreading the virus. Now, after the CDC made their announcement, many states and cities lifted their mask requirements. That includes the city of St. Louis and St. Louis County. So now there are two choices, really. You can get vaccinated, or you can continue to wear a mask to protect yourselves and others. It's even more important now for those who are not vaccinated to continue to wear a mask, because we know that there will be some unvaccinated people that will most likely not wear a mask. And so the risk of being exposed to somebody with COVID that's unvaccinated is much higher now, especially if it's in a crowded indoor space. So remember, if you've chosen not to be vaccinated, please do continue to wear that mask to protect yourself and others. Well, with that, let's take a look at our vaccine distribution status. And so, to date, vaccinators in Region C have administered around 1.6 million doses of COVID-19 vaccine. So that number includes around 930,000 first doses and 750,000 second doses. Now remember, this number is a little bit conservative because of the limitations of the state's vaccine database, so the actual number is probably higher than that. But again, we've made some significant improvement in getting people vaccinated. Now remember, all Missourians 12 years of age and older are now eligible for COVID vaccines, and there's more choices than ever now about where you can go and get your vaccine. Now there's many mass vaccination events still occurring around the region. You can get more details and links to register at covidvaccine.mo.gov/events. So again, that's covidvaccine.mo.gov/events. Now, in addition to these website, which is vaccines.gov. Now, if you haven't already registered and received your vaccine, now is the time. The sooner you start your vaccination, the sooner you'll be protected from COVID, and you can start enjoying the benefits of being vaccinated, including not wearing a mask and not being concerned about becoming ill from COVID. So let's move on now to our hospital status. So as we start off with our new hospital admissions, today we're reporting our daily hospital admissions is down to 16. Remember, this data is delayed by 48 hours. And our rolling 7-day average is at 23. So we are seeing much better admissions numbers, and it's definitely making a turn down. Moving on to our hospital census, we're reporting 142 people hospitalized with COVID-19. The moving average now is at 161 patients. So decrease in that as well, although 142 patients in our hospital is still a significant amount. A little bit more detail on our daily numbers here. As we mentioned, 142 patients in our hospitals today with COVID, 48 patients in our intensive care units, and 24 confirmed COVID patients on ventilators today. Of our suspected COVID patients, we're reporting 23 persons hospitalized today with suspected COVID. We have 4 suspected COVID patients in our intensive care units, and we have 2 suspected COVID patients on ventilators. Moving on to our good news slide, we discharged 35 patients yesterday with COVID. Well, we discharged 35 COVID patients yesterday. We didn't discharge them with COVID, which brings us to a total of 22,241 patients. And again, big shout out to our healthcare workers who've helped these folks get better and get back home to their loved ones. Unfortunately, we're still reporting people that are dying from COVID as well, which again, even more reason to get vaccinated. Today we're reporting 3 COVID deaths in our task force hospitals, and the 7-day moving average is 4 deaths per day. We'll review our model here really quickly. Not a whole lot of news, although this graph is a little bit dated. We rerun our models every Thursday, so this is last Thursday's data. And so we'll see a considerable drop next week. So this is still running around that 200, 220 mark. But as I've mentioned, we've dropped down into the 140s in our hospital census. But be that as it may, it's still tracking along with our model. Our confidence intervals, which are sort of those lines that bound the best case line, will become more tightened because there's less fluctuation in the numbers. And the same thing with our intensive care unit patients. Again, those numbers are coming down. So I anticipate when I see these tomorrow that the curves will look a little bit different, but the model hasn't significantly changed. Really briefly looking at the epi curves from across the region, not a whole lot to report there. Still continuing to see lower numbers. Haven't seen any increases across the region in cases, so that's all good news. Moving now to our report card. More good news to report. As we mentioned earlier, hospitalizations continue to decrease, and so this is showing up as well as a percentage of beds occupied by COVID-19. So we're in the green area for both of our metrics there, around 3.7%, around 4% of total beds, and around 9% of our ICU beds. So those numbers have come down. Our rolling average for our admissions is 23, and you can see there that definitive downturn in admissions from about a week and a half ago. So sustained decrease. You know, we're going to see a blip every once in a while with those numbers coming up, but this has been a sustained pattern. So all good news there. Our prevalence of reported cases around 1.2, so it's about 1 per 1,000, which is good news. That means there's less opportunity for the virus to be spread. Again, that's a condition of, vaccinations occurring, people wearing masks because this is a rolling 14 days. So still getting some contribution from the mask wearing. Still in the red zone, but we're getting close to breaking through into our yellow zone. Our weekly change is looking favorable as well. So you can see that minus 27.5%. Again, that's comparing the immediate 14 days to the previous. And so if it's lower in the immediate 14 days, that's where you get the difference. So every day that we tack on that we have lower cases, this number will continue. It'll get bigger, but in a good way because it's a negative number. And then our positivity rate is down to below 5 now, which is extremely encouraging. As we reported very early on in the pandemic, that's where we always wanted to be, was below that 5% positivity. Now this is only healthcare systems reporting data, but we think it's a representative sample of the community, and so we're confident in this number as well. And then lastly is our reproductive number, which you've heard me talk over the past year about the importance of this number and staying below 1. So we're down to 0.82 right now. We did get down to around a 0.77 earlier in the week, which is really good. Need to continue to keep this number low in order to prevent people from getting sick from COVID and ending up in the hospital. So as you can see from today's data, COVID continues to spread in our community, although at a much slower rate. But it is almost exclusively amongst people who are not vaccinated. And so only about a third, well, a little bit over a third of our population is fully vaccinated from the virus, or to protect against the virus. So we still have a ways to go to get more people vaccinated. And with the presence of those more contagious COVID variants, especially the UK variant, and the end of the mask mandates, it's really important that we really all make those best choices to protect ourselves and our loved ones. So it's really up to you. If you've not been vaccinated, then you should really continue to wear a mask to protect yourself from getting sick. As I mentioned, we still have people getting sick, coming into the hospital, being on intensive care, being on ventilators, and unfortunately dying, and you don't want that to happen to you. So please, if you're not vaccinated and are not planning on getting vaccinated, then you need to be wearing a mask, especially if you're around people or live with people that are high risk and have not been vaccinated. We would hate for somebody to get sick for that reason. So although we're getting closer to the end of the pandemic every day, and with every person vaccinated, we're not done yet. The rest of the world still needs to get vaccinated. There's still a risk of variants cropping up that can evade the vaccine. So we all still need to remember that. But let's keep the momentum up. I know I speak for many people with feeling like we have more freedom now and are enjoying the outdoors and not having to wear a mask. So those are unvaccinated, please go out and get vaccinated so everybody can get back to that level of normal. So that concludes our update for today. I don't believe we have any questions from the media, and so we are going to go ahead and sign off. Thanks everybody for listening.